By the end of this tutorial, you should be able to list the indications for point-of-care ultrasound in first trimester pregnancy, describe the diagnostic criteria for intrauterine pregnancy, and identify other potential significant imaging findings.
Point-of-care ultrasound is a useful, radiation-free, and low-cost imaging modality for pregnant patients presenting with abdominal pain, vaginal bleeding, syncope, or hypotension. There are two approaches to acquiring images. The advantages of the transabdominal approach is that it is less invasive, typically has lower infectious risks, and probes are more widely available, while the advantages of the transvaginal approach are that it provides additional information since it allows for closer contact with the area of interest and uses a higher frequency transducer. The next few slides go over how to acquire the images, but because this is a skill better taught at the bedside, we will not go into specific detail for this tutorial. This particular slide focuses on obtaining the longitudinal view with the transabdominal approach. This focuses on how to obtain the transverse view, and this slide focuses on how to get these views using the transvaginal approach. The next two slides give you some reference ranges of beta HCG levels in relation to gestational age on this particular slide, but the main thing to note is that ectopic pregnancies can occur at any level of beta HCG, and no beta HCG value excludes an ectopic pregnancy. This slide provides reference ranges on what anatomical areas you can see using different approaches and in accordance with gestational age. Now we're going to discuss some critical definitions. An IUP present case is confirmed by visualization of a gestational sac and a yolk sac or fetal pole located in the fundal endometrium. A particular note is that when an IUP is not centrally located in the fundal endometrium, it should raise concerns for an interstitial or cervical pregnancy, and these warrant further investigation. In contrast, an IUP absent case is confirmed by the absence of a yolk sac or fetal pole in the uterine cavity, or a gestational sac or yolk sac that is not centrally located in the fundal endometrium. Other important imaging findings that could be related to pregnancy include a fetal heartbeat, multiple gestation, a gestational sac that is eccentrically located, heterotopic pregnancies, subchorionic hemorrhages, pelvic free fluid, adnexal structures, and an endometrial fluid collection or heterogeneous endometrial material. Fetal cardiac activity is expected on a transvaginal ultrasound at 6 weeks, while at the transabdominal it should be around 7 weeks. The absence of cardiac activity is suggestive of a non-viable pregnancy, but may also indicate that the assessment is prior to the dates where one can see fetal heartbeat. Multiple gestations are defined as at least 2 gestational sacs with respective yolk sacs and fetal poles, and below we describe some examples of multiple gestations. An eccentric location of a gestational sac is defined as when the yolk sac or gestational sac is not located in the central area of the uterine cavity, and this can indicate either an interstitial or cervical pregnancy. These particular findings indicate that further management is required. An interstitial pregnancy occurs when the pregnancy is within the interstitial portion of the fallopian tube where it passes through the myometrium before connecting to the uterine cavity. These are high risk for rupture and require prompt identification and management. Heterotopic pregnancies are very rare and occur about 1 in 30,000 pregnancies and occur when there's an intrauterine pregnancy and an ectopic gestation. A subchorionic hemorrhage is visualized as a hypoechoic area or anechoic area near the gestational sac. It indicates bleeding behind the chorionic membrane and may result in an increased risk of pregnancy loss or placental abruption. Pelvic free fluid is common during pregnancy and may not be pathologic, especially in small amounts. You can see it as hypoechoic or isoechoic debris suggestive of blood clots. If there is free intraperineal field with a positive pregnancy and an empty uterus, this is very highly suggestive of an ectopic pregnancy. The location of pelvic free fluid includes, on the longitudinal view, the pouch of Douglas and lateral to the uterus, while on the transverse view, it's posterior or lateral to the uterus. Below, we define how to identify small versus medium versus large amounts of fluid. If there is significant pelvic free fluid and/or small amounts of pelvic free fluid in an unstable patient, it is recommended to also assess the right upper quadrant and left upper quadrant for free fluid as shown in these images. An adnexal structure or mass may be cystic or echogenic, and if there's the visualization of a hyperechoic ring surrounding the extrauterine gestational sac, that is known as the tubal ring sign or bagel sign, and this often indicates a tubal ectopic pregnancy. An endometrial fluid collection or heterogeneous material includes mixed echogenic material in the uterus that is nonspecific fluid collections and/or disorganized cystic masses. Examples include endometrial fluid collection or an empty gestational sac. It could also indicate retained products of conception or a molar pregnancy. As we mentioned, the primary task is to locate and identify if there is an IUP present or absent. Just of note that the cursor has to be in the middle of the yellow area, which identifies a yolk sac or fetus to be considered a correct response. These are three examples that exemplify an IUP absent case. The first one demonstrates the expected location of the IUP in the center of the uterus. The second does the same, but also demonstrates some additional pregnancy-related imaging findings, such as heterogeneous endometrial material. And the third shows the expected location IUP in the center of the uterus with a visible endometrial stripe. This again is a list of other pregnancy-related imaging findings that might be significant in a pregnant patient that is symptomatic.
The development of this tutorial is thanks to the enormous efforts of everyone listed on this slide. This is where we summarize what we hoped that you learned from this tutorial, which includes indications for POCUS in the first trimester pregnancy, intrauterine pregnancy, definitions of present or absent, and other imaging findings potentially significant in pregnancy. Thank you for listening to this video. Are you interested in practicing some cases that put your newly found knowledge to the test? Case experience is available at ImageSim.com.